4:30. I'm Vanessa Rufus, and as you all know, the coronavirus is pretty much just taking over the world as we know it and life as we know it. Take a look at your screen. These are the latest numbers that we've gotten here for the Carolinas. 155 confirmed cases in North Carolina and 124 in South Carolina, and that does include one death. Here at WCNC Charlotte, of course, we are committed to bringing you the facts, and so that's why we are dedicating a lot of time to talk to the experts here. And so we want to bring back here Dr. Anna Maria Temple, who we've been joining with all week, and we appreciate your time. And Dr. Temple, we wanted to start off here touching on this misconception, and we kind of alluded to it in that last block of news with Carrie Sanders reporting from Florida. A lot of people think the concern surrounding coronavirus is just for older people, but we're getting some new statistics showing that it's really for everyone.
That is true. The recent statistics released by the CDC are showing that everybody is affected. And what I mean is from like 20s until elderly. It is still true that the elderly are most severely affected, most likely to succumb to death. But a lot of people are walking around going, this is an illness that is only affecting the elderly folks. And that is simply not true. The numbers show that about 49% of cases are in people less than 50 years old. So when you're walking around town and you're seeing, you know, folks in their 30s and 20s hanging out and walking their dogs and playing volleyball, it is not okay because we are all at risk.
And we should probably emphasize too, I mean, we've done it many, many times before, but it's not just about you getting sick. If you're a younger person, it's not just, oh, maybe I don't feel sick or I don't have the complications. It's the risk of passing it on to others who might have those complications, right? Could you talk on that a bit?
100%. You know, we look at ourselves generally, you know, as a culture, we're like, me, I'm good, I'm healthy, awesome. But we are forgetting that the person that you're talking to, or that is in the shopping line, or that is, you know, across the street from you, you don't know their medical history. They may be suffering from cardiac disease. So it's really not about me. It is about we, because we as a culture, as a country, need to come together in order to protect all those people who are just unwell or at high risk.
All right. Thank you so much for that insight. And we want to bring in now Bill, who is anchoring from home today. And Bill has a question. Go ahead, Bill.
I can't hear Bill.
We might have a bit of a delay with Bill, so just...
Oh, got it. Cool.
Bear with us.
No problem.
Okay, it sounds like maybe the delay might be too long for Bill, so I'm going to go ahead and ask his question. So
Sure.
He says some people might not know, but should people who aren't showing symptoms get tested for this?
Yeah, at this time, that I wish that we could, but we don't have enough test kits yet in North Carolina to be able to test everybody. Ideally, that would be amazing. So you know who is contagious and who's asymptomatic and who, you know, if your cough is a problem. However, we don't have enough test kits at this time, but that would be ideal.
And then this next question here, I wanted to ask it yesterday, but we kind of ran out of time. So we had mentioned that one of the hallmarks of coronavirus versus, for example, allergies is this fever. Could you maybe elaborate or clarify the definition of a fever and maybe what the cutoff point is temperature-wise that we need to be concerned?
That is a great question. And it looks like the fever is 100.4 or higher. A lot of people say, oh, you know, my body temperature usually runs low. So when I have 99, I have a fever. I will tell you that at this point in time, they are not considering, because we have to make a global adjustment. They're not considering 99.1 a fever. It's going to be 100.4 for us to consider that a fever, if that helps.
All right. That does help. That does help to know that information. And then lastly here, we have people, of course, who are quarantined at home or just practicing, well, it's the self-quarantine, some mandated to stay for 2 weeks. People are asking us, they want to know, what do you do once those 2 weeks are up? Do you leave the house? Do you continue to social distance? What's the protocol?
So at this point, so we're going to, if you leave the house, social distancing is going to continue for now indefinitely. still going to wash hands. We're still going to be able, because we don't know if you develop an immunity, or a lot of people, because there's not testing for everybody, you're not even sure if you really had coronavirus, or maybe you had flu, or you had a cold. So it's unclear at this time. So I would say once you leave quarantine, first, thank you so much for being in quarantine, and then continue with the same precautions after you leave quarantine from your house at this point in time.
All right, some very good insight from you, Dr. Temple. Thank you. And just, I guess, be on standby. We'll come back to you a little bit later. So
Sounds
thanks
good.
for that. All right, after the break, we're going to check in back with Dr. Temple, as we just mentioned. We want to kind of get her point of view on what it's like to be in the medical field at this time, and we'll be talking about some other news as well. We'll be right back. Welcome back. We continue our half hour of answers here. So we want to bring back Dr. Anna Maria Temple. And, we normally have some specific questions slated, but I wanted to take this block of time that we had just to have maybe like a candid conversation with you. As somebody in the medical field right now, and certainly someone who has probably spoken with fellow medical professionals lately, I just wanted to see, what has the sentiment been like, at least amongst your peers that you've been talking with at this point in time?
I just got a picture from one of my friends and she's in general practice in just a clinic, and she is covered from head to toe in protective gear, and she has goggles on, and she has a respiratory mask, and that's how they're seeing patients throughout the day at her clinic is what I was able to see. And it's, the level of stress and anxiety is high, and my husband is going to be traveling to Indiana Saturday, where he works as an orthopedic surgeon there, and a lot of his patients are in the ICU. So that's going to be a whole nother ball game, and I can't say that I'm not a little bit nervous.
Yeah, we've just been seeing these images from other countries, and like in Italy, nurses slumped in the hallways, sleeping there because they can't get enough time, enough breaks to actually take a legitimate nap and take a legitimate break, and it's concerning to see that over there. And hopefully we never get to that point here. Us in there with your perspective on that. And we do want to continue our conversation with you, our question and answer, in just a few minutes. We're also going to be checking in with another check of that weekend forecast. So stay with us. We'll be right back. Welcome back. We're getting more questions answered for you here on WCNC Charlotte. So bringing back Dr. Anna Maria Temple now, and we will bring Bill back in just a moment. But first, Dr. Temple, you wanted to talk about and elaborate on these new CDC guidelines regarding this personal protective gear. What's the latest we need to know about this?
So the latest thing that came out in the past hour is coming back to work, because it was 2 weeks of quarantine, and now it's they're like, well, as long as you are fever free for 24 hours without medication, because 2 weeks of quarantine, if you've had exposure to a patient, is a long time, and it's going to put a huge strain on the medical system. The other thing that has come through is that if hospitals are running out of the N95 respirators and other protective gear, that if you're feeling unwell and want to protect yourself, you can use a bandana or a makeshift cover over your mouth. And it's really gotten a lot of people concerned. And I think that's another reason we as a community want to not spread this, because we don't want to put our healthcare workers at this incredible risk.
Right. We don't want to spread it, and we also don't want to take up those supplies unnecessarily. We had seen the in the past couple of weeks, that run on masks from, for lack of a better word, civilians. All right. So let's go ahead and bring Bill back in now. And Bill, you have a question to ask. Bill.
Yeah, well, doctor, my question has to do with the symptoms. And so we've heard about the fever and the dry cough. Can you get the symptoms independent of one another, maybe at different times? And if you do, which symptoms should you be more concerned about, the cough or the fever?
I would say we had to think on this, and when we looked at the data coming from all the people, it looks like 44% of people present with both fever and cough, but we're looking at cough and shortness of breath at the beginning. One way to kind of raise your alarms, fever may not necessarily happen until about day 2 or 3. So I would say cough, dry cough, so you're not making any mucus, nothing is gurgling in the back of your throat. Cough and shortness of breath should alert you that you may indeed have COVID-19. And then if the fever comes on, but that would be, let's say, a secondary symptom for right now to help.
All right. Sounds like, Bill, you have a second question too?
Yeah, just about this run on toilet paper. It baffles a lot of people, and I just want to be clear when I ask this that there's really no gastrointestinal component to this that would make you want to be concerned about running out of toilet paper. Am I correct on that?
You know, I've been baffled over the toilet paper since everyone started buying out toilet paper as well. And I think that a lot of people, because we keep saying it's similar to flu, they're like, oh, well, when I have the flu, I have the stomach flu, therefore I have diarrhea. And this, a minority, and I mean like tiny, tiny fraction of the people have any stomach issues. The majority is respiratory, like we talked about. So I'm not sure if it was a quarantine thing, but this is not a stomach bug by any means.
All right, Dr. Temple, I guess I will take the next question
That's a great
here.
answer, yeah.
Could you give any tips for folks who might be doing this remote working like we're all about to be doing soon, just about maintaining good mental health? I feel like, you know, one day inside the house could make one person stir crazy.
Well, yeah, yesterday I had a cough, so of course I stayed home immediately, and I watched my children, you know, they're teenagers, and I'm yelling after them to do stuff, and my house is a mess, and it was really stressful. So I could see how working from home actually could be stressful for a lot of people. So the way we managed it, we actually had schedules, and everyone had chores that they had to do, and then I would take breaks and go outside. If it wasn't possible for me to go for a long walk, I still have a balcony so I can get some sunshine and fresh air. And during the breaks, turn off your screens and your media. Just let your mind rest a little bit, because it's becoming so difficult for our minds to rest in this pandemic.
Yeah, it's so true. I mean, you basically wake up and then you're plugged in and you're getting all of your updates, which are important, but also taking some time to care for yourself is important too. We can see that. All right. Thanks, guys. We're going to leave it there for now. We're going to join you again in just a bit. So we'll get back to the facts. You know, when it comes to coronavirus, our Q&A continues here with Dr. Anna Maria Temple and Bill also joining us. So temperatures, we'll kind of springboard off of weather here. Temperatures climbing in the Charlotte area right now. Some people are wondering, Dr. Temple, if heat can kill the virus, or if the opposite is true, perhaps, if colder temperatures can kill the virus. Any data on that?
Gosh, there's no data. It's so new. We have no idea. It's come in the winter and nobody has seen it in the summer or in a hot. I have nothing on that.
Okay. All right. I guess we're going to learn as we go along. We're getting information by the day, so who knows? Maybe we'll have the answer to that soon. Bill's got a question. Bill?
Yeah, one of the questions I have, there's a claim on social media that taking ibuprofen, if you have a fever for this particular virus, is somehow bad. Is there any data on that?
So the data came out, it actually, I think yesterday morning there was something on that, and then the WHO on Twitter specifically said that there's no data that they have between ibuprofen and COVID-19. However, in the British Medical Journal, they are suggesting that by talking to the various doctors from the countries that are afflicted with it, that a Tylenol or acetaminophen may be a better idea when treating fevers coming from COVID-19, just alerting us to the fact that fever is good and it does help take care of this virus, and that we should be careful not to over-medicate ourselves in this pandemic.
All right, some good advice there, Dr. Temple. Another question here that folks keep asking, if you catch the coronavirus once, can you get it over and over again?
At this point in time, we don't have any evidence for that because it's so new. If it's going to act like the flu, like influenza, then technically we should get antibodies, but we've never seen it, so we have no idea, and it's too soon to tell if people who were sick in December have antibodies, because we need to develop those tests, and those have not been a priority at this time.
Yeah, once again, a situation where time will only tell. All right, Dr. Temple, thank you as always. We've appreciated your time throughout the week. And Bill, thank you.
It's been great to be here. Thank you.